Hello everyone, I am your hacker Dr. Mayukh Hazra and I will show you ways how to hack a MCQ exam, be it NEET PG, INICET or FMGE. There are 7 hacking techniques that I am going to discuss and these are very much important for an MCQ exam. And believe me, these all are ethical hacking. This is not like NTA ki grace marks de diya chalo 500. So these are all ethical hacking techniques and these are not illegal. And in the 7 techniques, I have taken questions of NEET PG mostly, FMGE and INICET. As you all requested that please make another MCQ discussion video on the previous year NEET PG, INICET and FMGE questions. So I have included that, but with the techniques of hacking. So this is going to be more useful than the previous video. That is the art of ruling out options. So tip number 1 is use common sense. During the exam, you should use your common sense. Many questions could be solved by common sense if you even don't know the answer. So coming to the first question, this was asked in NEET PG 2023. A 4-year-old child has easy fatigability. The mother also complained that the child was more hungry in between the meals and recovers after food. The liver biopsy revealed no glycogen. So there is no glycogen. This is only pointing towards diagnosis. So glycogen is only not there, means glycogen synthesis is nahi ho raha hai. So glycogen synthesis would be the answer. Why to look into the other options? There is no glycogen at all. Okay, so this is called type 0 glycogen storage disorder. GSD. There is no glycogen storage only. So this is a misnomer. This is not a glycogen storage disorder, but it is a glycogen formation disorder. So no glycogen means glycogen synthase is only not there. Like this. Use the common sense. Coming to tip number 2, that is the conceptual thinking. You should use your conceptual thinking to answer questions during the exam hall. So you should keep the calm in the exam hall, not in stress. A young boy, while playing, had tiredness and muscle cramps. So while exercising, he was having tiredness and muscle cramps. He had no free glucose and low lactate in the blood collected soon after exercise. What is the likely diagnosis? So muscle cramping is there. So it is a muscle glycogen storage disorder. And from M we know M for M, muscle. So McArd's would be the answer. Von Gerks we know that G6P means glycogen 6 phosphatase deficiency is there. In Pompe's disease, there is acid maltase deficiency in the lysosomes, and in Cody's C for D. After C, the next letter comes D, that is the debranching enzyme. It also involves the liver. So muscle is shown, that is the McArd's disease. And why there is low glucose? Because there is no glycogen in the muscle. So glycogen will take up glucose from the blood during exercise. And so there would be low glucose in the blood. In the bloodstream, there would be low glucose and low lactate, because from glycogen, glucose is formed. And from glucose, due to anaerobic glycolysis, lactate is formed. So less glucose is there in muscle, so less lactate would also be formed. So this explains why this is the answer. But if you understand that this is a muscle cramps is there, so it is a muscle disorder. And from the mnemonics we know that M for M, so it would be McArd's disease only. There is second wind phenomenon that is seen. This could be a futuristic question. Second wind means after exercising and resting for a bit, the patient improves. So this is called the second wind phenomenon. Coming to an FMGE 2023 question. So FMGE is also knocking the doors. Okay. So I have taken few FMGE questions also that are conceptual. So this is a conceptual question. Which of the following is the cause of the condition given in the image? So we all are familiar with the image. This is looking like what? This is looking like an orange. So this is called PUD orange. We know it is due to the involvement of lymphatics. You can rule out the option also. In skin, if it was a skin, then it would be ulcer, nodule. You can't see any like that. If it is artery involvement like this, it is not seen on the skin. So superficial or deep lymphatics. Now apply the concept. If it was deep lymphatics, it would involve the lymph nodes. In skin, there won't be any indentation. If it is superficial lymphatics only, if there is, see, these are the layers of skin, the epidermis, the dermis. So here are few lymphatic channel. So it is blocked by the malignant cells, and it would increase the traction and would indent the skin. So this would look like this. This is what is called peau d'orange. It is causing traction, like the Cowper's ligament involvement also. So superficial lymphatic can only cause the traction that could be visible on the skin. So the answer would be the superficial lymphatics. Like this, apply your concepts. Another question is there. A 4-year-old female. This is a very common question. This could be asked in any exam. This is a very common question even in your MBBS also. A 4-year-old female brought to emergency department with complaints of accidental ingestion of coin while playing. A chest X-ray of the child is given below. Which of the following is the management of the patient? So in the PA view or the AP view, you can see a coin, or it could be a battery. I think I have done a mistake in taking out the image, because this is a battery. Okay, consider this to be a coin. This could be a coin also, not looking like a battery also, but here an indentation is there. Battery would have been more smaller. Now this is in esophagus or trachea. You have to know. Esophagus, we know that it is compressed in between the vertebral muscles and the trachea. So if a coin would fall, it can't be in the anteroposterior diameter. It would be like this. In PA view or AP view, if you see, you would see the whole coin. This is the AP view. This is the lateral view. But in case of trachea, we know that it is a circular, and the anteroposterior diameter is more than the horizontal diameter. So the coin would be like this in a lateral view, and in AP view it would be like this. This is the basic difference that I think all of you know and your faculties have taught. But here doesn't lie the twist. Which of the following will be the management of the patient? The coin is in the esophagus. If it was battery, the management would have been different. Here it is mentioned only in the question, it is a coin. Esophagoscopy may be there. Bronchoscopy? No. This is not in bronchus. This is not in trachea. So bronchoscopy? Nothing. Heimlich maneuver? No. That is some obstructed food particle suddenly causing obstruction in the trachea. Then we do the Heimlich maneuver. Now two options are left: esophagoscopy or wait and watch. We know that the narrowest part of the GIT is the cricoesophageal sphincter. If any object crosses this, then we think that it can cross the whole of the GIT also. And this has crossed the cricoesophageal sphincter. Here you can see the cricoesophageal sphincter, and as I have said, this is in the esophagus. So it is in esophagus, it has crossed the cricoesophageal sphincter. Now your management would be wait and watch simply, not esophagoscopy, because we think that which has crossed the cricoesophageal sphincter, it is going to cross the whole of intestine, and from feces it is going to come out the next 2 to 3 days. If it was a battery, if I change the question to battery, so this is also a technique that don't jump to diagnosis. I'm going to show this tip also after this. But if I change the question from coin to battery, the answer would have been esophagoscopy, because we know that the coin can cause chemical damage and perforation of esophagus if it stays for a long time. So if you change just from coin to battery, the answer changes. And if you change the image, then also the answer changes. If you give the image of coin stuck in trachea, then also the answer would change to bronchoscopy. Tip 3 is reflex. Some questions we need to solve by reflex, that we have practiced this question so many times and there is no twist in the question, that we can solve it by reflex. I also told that I had solved some of the questions by reflex when I gave the marrow mock. If you have not seen the video, you can see that after 1 year I gave the marrow mock and how much score I got. You can see the video. A patient came with DDD, diarrhea, dermatitis, dementia. Finally, it can occur death. Which vitamin deficiency? Niacin, vitamin D3. This is a reflex. Clotting factors that need gamma glutamyl transferase is 2, 7, 9, 10. You have to remember this. First factor that is deficient is the 7, because it has the shortest T half. So the PT would be increased. First, the PT would be increased. In case of liver scoring also, child pug, male, you see two factors, that is the bilirubin that is dependent on liver, and PT or INR. This would be common in all the scoring. You see, check that there would be bilirubin or PT or INR. Futuristic question could be, a child with fat malabsorption syndrome has deficiency of which clotting factors? Because vitamin K is fat soluble vitamin. So in case of vitamin K deficiency, 2, 7, 9, 10 would be deficient. What would be the first factor deficient? 7, of course. Tip 4, ruling out options. You liked the video of ruling out options, so here are more some questions where I would try to rule out options, and this is the main technique. This is the main technique. We answer most of the question. This is the main hack that we use. Even the toppers also use. Toppers don't know that all the 180 or 190 questions they made correct. We rule out options. We know only 120 to 130 questions answer right. Rest we rule out options. A child with perioral dermatitis, impaired wound healing. The most likely mineral deficiency associated with this condition. This is a NEET PG 2023 question. Most of you know that the diagnosis is acrodermatitis enteropathica. But if you don't know, iron deficiency, it could cause hemoglobin, anemia, like that. Calcium deficiency, it is going to cause Vostek sign, Trousseau sign, not this. Copper, you have learned 2 copper disorders, that is the Menkes kinky hair and the Wilson disease, where in Wilson the copper is excess. So this is not the answer. So rest, zinc is left, zinc would be the answer. In breast carcinoma, which of the following has good prognosis? Ki67 means, what is the proliferation index? Ki67 means. So more Ki67 means more proliferation. So this is a bad prognostic factor. This is not the answer. P53 mutation, you all know that it is a tumor suppression gene, and if there is mutation, it is bad, not the answer. BRCA mutation, bad, not the answer. ER positive, so you can give trastuzumab. This is the answer by ruling out options. A 10-year-old child, this is a conceptual also, with weight 30 kgs, pH 7.01, acidosis is there, sodium is raised, RBS is 550, urine sugar 3+. So this is a child with DKA. There has been history of loose stools for 2 days. Infection causes DKA also. Infection is a predisposing factor for DKA, and there is severe dehydration. Criteria, I don't know. How I answered this question, I am telling you. Initial ABC everywhere it is there, and this option is wrong. After 1 hour. I didn't know the means child guideline, but I knew the adult guideline, that is you should infuse 1 to 2 liters of fluid. After 1 hour you give insulin infusion. First the hydration is main. With hydration the blood glucose will also go down. After 1 hour you start the insulin infusion. So after 1 hour either B, or after 1 hour is there C. B or C would be the option. 10 ml per kg. I calculated the normal body weight of an adult is 60 kgs. So if I multiply it by 20, it is coming 1200, means 1.2 liters. It is in the range. But if I multiply it by 10, it is coming 600.6 liters. This is falling within the range. So I compared the adult with the child. Like this I marked the option, that is you should give 20 ml per kg. Like this kind of concept you have to apply. You have read something in somewhere and you have to apply the knowledge in something other. Like this, ruled out 2 options. And if you can't apply the knowledge also, if you have ruled out 2 options, go for it, go mark for it, be it NEET PG, be it INICET, and FMGE, so you have to mark. This is a INICET question. Which of the following is a new drug approved for Rett syndrome? Think you don't have any guesses. These 3 drugs are meant for migraine, we all know. This is CGRP, and this is 5-HT1F agonist. So these 3 drugs are meant for migraine. 1 drug is left. That would be the answer, trofinetide. A 4-year-old child, intermittent jaundice and splenomegaly. There is history of similar complaints in elder brother. Peripheral blood smear shows the following. How will you investigate the condition? You can see there is loss of central pallor. So these are all spherocytes, and this is NEET PG 2023 question. This is a controversial question and many of you have asked me to answer this. 4-year-old child and elder brother is there. This is AIHA. So spherocyte could be seen in HS and AIHA. 2 options ruled out. Now you mark. You have 50% chances that you are going to get it correct. Now see, 4-year-old child means it is a hereditary cause, and elder brother was also suffering. So it is hereditary. So HS, hereditary spherocytosis, would be the answer. A 16-year-old male presented with recurrent profuse bleeding from nose. What would be the treatment in this patient? This is an FMGE 2023 questions. Juvenile nasopharyngeal angiofibroma. So FNAC and biopsy are completely contraindicated. 2 options ruled out, and radiotherapy in more severe cases you can give. Why would you give radiotherapy and cause so much side effect, so much damage to the patient? So surgical excision would be the answer by ruling out options. Focus on twister. This is the tip 5, that there are some twisters you should focus on. This example I had given in ruling out the options, so I am not reading that much. Child with cola colored urine. So this is a case of PSGN which has progressed to RPGN. In the last line there is a twister electron microscopic finding. During my NEET PG exam, I used the cursor to read each and every line and each and every word so that I don't miss anything. In the last line, there was electron microscopy finding. This is not an light microscopy finding that you would see crescents. So this is subepithelial deposits. If you miss that and you think it is crescent, you have missed the electron microscopy and thought that this is a microscopic finding or the light microscopic finding, then you would be wrong. So you have to focus. There are twisters in NEET PG 2023. So there would be twisters in NEET PG 2024 also, in FMGE also it could be there. Tip 6 is know what to leave. I left 2 of the questions unanswered and one of them was this, and this is still a controversial question that no one has the correct answer. Which of the following is true regarding Mendelian mode of inheritance? This was asked in NEET PG 2023. 2/3 of the Mendelian disorders is autosomal dominant. I know that autosomal dominant is the most common, so this could be correct. 1/3 of the Mendelian disorders is autosomal recessive. This could also be correct because autosomal recessive is less. Every 5th patient is X-linked recessive. I don't know. Every 10th patient is Y-linked recessive or Y-linked. So I can't rule out options. Why would I go to mark this kind of questions? I can't rule out any options. I think these 2 are correct and these 2 I don't have any idea. So if you can't rule out any options and it is a new question, try to leave it. Know what to leave. Then you would get 1 marks less negative, or in INICET it is more important where there is 1/3 negative. And tip number 7, don't jump to the diagnosis. As I explained that if one word of the question is also changed, the diagnosis changes completely. 15 number question is there. A patient complains of knee pain for last 3 months. There is no history of trauma. No history of trauma. Following her radiograph, the correct pair of diagnosis and management. I saw all the options, but only one option was asked in previous year question, that is avulsion of patella or patellar fracture. You can see a patellar fracture is there like this, but patellar fracture, if it is traumatic, it ideally looks like this because here is the quadriceps muscle pull and here is the tendon pull, so ideally it breaks there. I noticed that. I noticed there is no history of trauma, but for 3 months only she is complaining of pain, na? So maybe some trauma was there, she didn't notice. And I marked avulsion of patella tension band wiring because this was asked previously in 2 times a PYQ. It was there in INICET and in NEET PG. But interesting fact is that in the exam here small bipartite was written there. Most of us didn't notice. It was very small, means I didn't notice only it was written. Some of my friends were telling that it was written. So diagnosis was given, and if you also don't make the diagnosis, then this is not a fracture of patella because there is no trauma, and the location is also not looking like the fracture of trauma. So this won't be the answer, this won't be the answer, avulsion won't be the answer. One option is left, bipartite patella. It is mostly a congenital defect, so you advise chest x-ray of another knee because there 50% of the cases it is bilateral, so you advise x-ray of the another knee also to see if there is bipartite patella. It is mostly asymptomatic, and if there are symptoms, that is mild pain only. It doesn't require that much management. You advise x-ray of another knee and you see also the skyline view. The AP view, this is shown. This was only shown in the exam. Skyline view was not shown. I saw that some of the apps mentioned the skyline view also, but skyline view was not shown in the exam. So I think you got all the hacks, all the 7 hacking tips. And obviously, if this video was helpful, do share this video with your friends. Be it anyone who is targeting for PG or FMGE, be it a first year or second year, they should know the tips and tricks to rule out options. To do share it with your friends, and if you are new to my channel, do hit the subscribe button because you can understand how much helpful the videos are. And my Telegram channel is there. You can get the link in the description below, and also in my account, that is Medico Magic. Do join there. We discuss some of the important questions, and all the NEET PG important topics list is also given there. And on Instagram I post some educational reels and dermatology life. It is by Dr.Mayukh Hazra. You can follow me there. so that you get updated about the educational reels I post. And obviously all the best to you, and here another video is popping up, so go give it a view. Bye.